Hi, I'm here today with Skelly, and we're going to talk a little bit about, well, not we, but I'm going to talk a little bit about how neck pain generally doesn't come primarily from the neck. Full disclosure, if you dive headfirst into a sandbar at the beach, it's probably a neck injury. If you have an automobile accident and you're struck from behind and your head whips back violently, that's likely a neck injury. There are neck injuries, and there are primary problems in the neck associated with neck pain that cause neck pain, but most of the time what we see in the office is not neck pain itself, but it's coming from another area. And typically what happens is the thoracic spine loses mobility. When we look at the thoracic spine, we're considering the shoulder girdles here, the rib cage here, and if we turn around even the scapula in through this region, and this area here should have a lot of mobility. Ideally, we were going to stand up straight, but many times through our neck posture, we go forward this way, the head comes forward, the neck comes forward, and then we tend to compensate with the lower back by extending this way, the belly shoots out, and the head is forward. And this posture here creates a stiffening or a tightening of the upper back. And if you can see Skelly from the side, nice and straight up and down, the ear and the head are aligned well over the shoulders, which is aligned well over the hip and the pelvis. If I contrast that like this, you can see my belly and pelvis are far forward, and there's nothing supporting me underneath that upper part of the back. This forward posture here reduces shoulder and neck motion. If I'm in this position and I want to raise my arm all the way up this way, I can bring my arm up to here. But if my head and neck and shoulders are in this position, that same arm raise only goes this high. For me to go higher, I then anchor to the neck. For me to move my arms and shoulders in that posture, I have to anchor to the neck. My head is not supported by anything underneath. The musculature is overworked because the neck is not stabilized by the upper part of the back. And the majority of patients that I see who come to me with a neck pain, oh, I can't sleep at night, I can't find a comfortable pillow, I can't, when I'm working during the day, my neck hurts. These are classic signs and symptoms of upper thoracic syndrome, or what we call upper cross syndrome and lower cross syndrome, or thoraco-lumbar syndrome. These are all different names for areas where the thoracic spine becomes involved. Loss of normal movement pattern. The neck then has to work beyond its capacity. The muscles become fatigued. The joints become irritated. The nerves become compressed and compromised. The muscles turn into a spastic mess. You get trigger points and like, oh, my neck, I just need that C2 adjusted, doc. Can you push the, I need a traction move. I need, yeah, it'll feel better for a short amount of time, but the real key to getting this fixed is working that upper thoracic spine.